Singapore is an interesting case to look at. Currently, they are having more and more Singaporeans being infected without having traveled out of Singapore or gone to China in particular. So clearly there is community spread within limited groups in Singapore, but so far it appears they still have a control. They can still track everyone down. But as more and more pockets come up, there could be a risk it might spill out, and the public health chaps in Singapore may not be able to catch up. And once that happens, it becomes like Wuhan, a sustained local human-to-human transmission, which you cannot find a link. In that case, then we may have to do things like what China has to do, hopefully not, you know. Now, Malaysia, we have not documented any sustained local human-to-human transmission so far. The numbers have been relatively small. Most of them were foreigners. We have some Malaysians who picked it up through interactions with them. So all this we could still tie in. So we are probably at the moment, based on the data we have here, one step sort of below Singapore in the sense. But you're right, we might get there, we might. And that's why I think it's important for us to continue to be cautious because Singapore and us are so interconnected in a sense. So I think it will be prudent to be aware and continue to have a surveillance on the ground so that if we start picking up signs, our control measures may also need to escalate appropriately. SARS, I mean, I'm an ID physician. Was I trained for something like SARS in 2002? No, none of us prepared for something like SARS, you know. But SARS actually helped us a lot. We put a lot of protocols in place. WHO is pushing all member states to do that, and we did that as well. So we have a preparedness plan, you know, for things like that. So when MERS-CoV came along, you know, about 10 years later, we were certainly a lot more prepared. People training people, training people. The first, when SARS hit and we saw doctors and nurses dying in Singapore and in Hong Kong, it's a terrible feeling, and to send doctors and nurses into harm's way. That was my biggest takeaway. I think at the end of the day, we have to protect our staff. It's the person doing that work day in, day out, dealing with the patient who gets angry because I'm stuck here for 8 days, I can't take it anymore. Did we have that? Yes. Shouting and screaming away, and you go in and pacify them. And I think we bought ice cream for him. Terrible. We send in ice cream. It works. Now I learned something. Ice cream works. It cools them down immediately.